Welcome to Cosmetic Clinic. I'm Dr. Shinal Shashankan, Consultant Plastic Surgeon, Cosmetic Clinic, Chaka, Trivandrum. So today I will be sharing with you snippets of small procedures that are commonly done at our clinic here. First, I'll be talking about ear piercing. Now, ear piercing is a very common procedure done at a lot of centers, done at jewelry shops, hospitals, beauty parlors. So here we have clients that are babies who come for their first piercing or adults who come for their second or third piercing. They can be males or females. So there are generally quite a few instruments that you use in doing ear piercing. First, a disposable ear piercer set like this. This is a one-time usage equipment. It comes with a preloaded earring, and it can be just applied to the place where you need to the earring to be pierced, and you use it and you dispose of the plastic equipment. The earrings that come in this can be worn for a period of 1 week and then can be changed over to a stud or earring of your preference. Next are guns like these. These also come with preloaded studs that you can choose according to your preference, and the stud is placed here and it is again pierced at the site of your preference. We also do piercings with gold earrings. This is done with the help of a needle. Now, if your pain tolerance is very low, we usually apply a numbing ointment prior to the procedure, after which the pain is comparatively nil. Next, I go on to ear lobe repair. It is technically known as lobuloplasty. This usually happens when the ear hole enlarges over a period of time. It can be due to a lot of reasons. Can be due to age, can be due to wearing of heavy dangler earrings for a very long period of time. Can also be due to a constant allergic reactions against plated jewelry. There is an allergic reaction that then gives rise to an inflammation and the skin becomes very thin there and the hole enlarges. So here what we do is we have to stitch up the hole. Now this again can be done in two types. The hole, a little bit of it can be retained so that you won't have to do a re-piercing later, or the hole is entirely sutured back, that is stitched back again, and then you will have to re-pierce it later. Now whether we can leave the hole intact or not can be decided only after seeing the client. It will depend on the client's skin texture, the size of the hole, the size, the length of the ear lobule, how much of it is left beneath the hole and how much of it is left above the hole. So depending on that, we can advise you whether you can have a remnant hole left or whether we'll have to stitch it up completely and then re-pierce it again. Usually this is done in the OP itself. A local anesthetic injection is given and the procedure is completed in half an hour. The stitches, however, have to be taken and you will have to come back in a period of 5 to 7 days for stitch removal. A re-piercing can be done in a span of 2 weeks when the wound is completely healed, and then you can get your new re-piercing done and the stud put. The third, I'd like to talk about keloids. Now what are keloids? Keloids are small swellings. To the normal eye, they look like small swellings that appear at places where you have an injury. So why do keloids develop? It can depend on their ethnicity, on the genetics, on the race of the people, and you see keloids only occurring in specific parts of the body. Why do they come? It is the body's own tendency to heal itself. But in case of a keloid tendency person, the body heals by producing excessive tissue. And this leads to the formation of small swellings. Now these swellings are usually commonly seen when you have your second stud earrings put or pierced. What is the treatment for keloids? Well, actually there is no effective 100% treatment for keloids. Is it a problem? Is it something cancerous? Can it cause harm later in life? Actually, no. They are just overgrowths of tissue. It is not a malignancy. But then yes, it causes a cosmetic deformity and you're worried about it because it shows, especially in areas like the ear. Now, so what can we do for these keloids? If the keloids are big in size, you have to resort to surgery. That means we cut off the swelling. Now, if we cut off the swelling, again we are causing another wound, and again this will heal, forming another keloid. So we have to take strict and stringent measures after the surgery to make sure that this does not happen again, or at least we can slow the growth, slow the healing phase so that the keloid can be controlled later. This is done with a lot of techniques, a lot of theories and a lot of studies have been put into keloid prevention of keloid formation. One of the most common things that we do is application of such silicone gel sheets. Once it is excised, we put such silicone gel sheets over the area that has healed, and this provides compression, and so the keloid tendency regresses over time. It can also be done with pressure studs like these. Okay, these are magnetic pressure studs. These can also be applied. They can be separated and put on either side of the ear. Now that is the good thing of a keloid appearing on the ear, because you can apply pressure from both sides. Now on places like the chest, only the silicone gel sheets are an option, and we cannot put any pressure such as the pressure studs. Will keloids recur? If you are careful and if you do follow our instructions, we can prevent them to an extent. If they become larger over a period of time, the next treatment that we resort to are steroid injections. These have to be taken 3 weekly or 4 weekly intervals and over a period of 3 or 4 times to cause their decrease in size. I hope I have provided you some information about these common procedures, and if you have any comments or queries about these procedures, feel free to call us up on our WhatsApp number or messages, or you can even drop your comments below and we shall reply. Thank you. Have a good day.